Sure. So the Neuroscience Center is 9 stories. Its focus is neurosciences as well as heart services. It has 224 beds and is an incredible addition to our campus. One thing we wanted to accomplish with this project is we wanted to get all of our neuro patients and heart patients in one location. And so we were able to do that for the neuro patients, and we were also able to move the heart patients closer to the McConnell Heart Hospital. But another thing that allowed us to do with the expansion is move to nearly 100% private rooms. And that's something that's very important to our patients and actually will provide a safer environment for them in the future. Well, for one thing, noise, and just sharing a room when you're not feeling well. Sharing a room with somebody else is really not what you want to do if you're going back and forth to the bathroom. Also, confidentiality is a concern with semi-private rooms because you have families right next to each other, separated by a curtain, so they're able to hear sensitive information as it's being shared with the patients. Also, just from an infection control standpoint, it provides some benefits, not having 2 infectious patients with each other. Also allows for additional capacity because one of the things we have to do currently with a number of semi-private rooms is we have to select which patients can be partnered with each other. And so by having all private rooms, that really gives us additional capacity because we're not dealing with using semi-private rooms as private rooms because we have an infectious patient. Well, Riverside has been the leader in the community from a neuroscience perspective and one of the leading programs in the country. So it just made sense as our program continued to grow and we have a comprehensive program with all of the necessary specialists and so forth that it would be here at Riverside.
It's easy to be different when there's nothing else like it. So for starters, in the entire state of Ohio, there is not any one center that's serving both inpatient and outpatient neurologically compromised patients under one roof. So this was our chance to really bring together the talent, the opportunity to do this, and knowing that there was nothing like it in the state, certainly the region, let alone the state, was a great opportunity for us. Neuroscience is a strength. We were very, very fortunate here. And it started really at many of our campuses, but particularly here at the flagship of Riverside Methodist. There was a group of several neurosurgeons, a complement of neurologists, and over the years we just kept getting more and more patients, more and more families seeking us out. So actually back in 2009 we got a little more concentrated about it, and we went after it, and we've invested a great deal in terms of recruiting staff, recruiting physicians, obviously a facility like the OhioHealth Neuroscience Center. We're growing it across the entire region throughout all of our hospitals, and knowing that this is such a growing market in terms of what patients' needs are going to be in the future was important for us to do this. Like this one. There's an interesting phenomenon. There are far less neuroscience physician specialists as compared to what the need is. So for the foreseeable future, the demand that we're going to have in our communities is going to be in excess of the supply. So what we're going to have to do is regionalize some care, and have these opportunities, especially for the subspecialists. For example, a cognitive neurologist, they're pretty hard to come by. A neurologist who deals with neurological cancers, pretty hard to come by. So a regional center like what we're doing here, the chance to have general things seen out in the community and then have a tertiary quaternary center like this will be really important for patients, not just in our region, but in the state of Ohio. We would have been actually hiring additional physicians because back to, there's such a growing demand for neurology and neurosurgical services as well as behavioral health and the whole complement of what neuroscience patient care entails. So we would have been needing to do that even without building a building. The fact that we were able to do this project certainly led us to give a very nice facility for physicians to be able to be a part of. When they can be a part of the design, it makes it that much more exciting, and they feel that ownership, and they really take that to the next level of how they take care of their patients. We have to hire certainly additional environmental service workers. After all, we're adding over 400,000 square feet, so that means there's certain folks that have to be added to the staff. Some nurses, a lot of patients. Remember, one of the primary things for this building was also about private rooms. So therefore, we didn't have to hire quite as many nurses because the patients are largely being taken care of today. It's just that the opportunity for them to have their own private room will be indeed a great opportunity. So the Neuroscience Center is going to have an impact, quite a bit of an impact to the patients and the families' lives. This is, again, it started with how everything was designed. It was what would make it easiest for them. So whether it's wayfinding, whether it was the colors schemes we picked, no matter what it was, it had to be about them. So the impact is certainly the kind of healing environment we set out to do. Another significant impact is back to all of the services and things we put under one roof. So for us to help actually coordinate their care, conserve the number of appointments, conserve all of those things, you know what? They don't have an easy journey. Our job is to make it better. And so I hope that the most significant impact we have is if they do have to come here, what they feel. And then it also goes beyond the OhioHealth Neuroscience Center itself, because with every single one of them, some of our heart and soul should go with them.
This is going to be an all-encompassing, comprehensive neuroscience center so that patients can be taken care of from diagnosis to acute treatment to follow-up. So there will be multidisciplinary clinics where patients can be seen. There are imaging capabilities, so they can have CAT scans or MRIs. They can have brainwave testing if they need it. If they need to be admitted to the hospital for care of a problem such as a stroke or a brain tumor or for spine surgery, we have 234 new private rooms where the patients can be cared for. We have 8 operating rooms and 3 procedural rooms for intervention for stroke and blood vessel problems. We have focused radiation facilities here. So really we have comprehensive capabilities for caring for patients with all kinds of neurological ailments. There has been a terrific expansion of technological advances, such as the trend towards minimally invasive surgery, whether it's smaller openings in the skull for brain surgery, smaller openings on the spine for spinal surgery. Also, there have been new drugs that have developed for things like multiple sclerosis and Parkinson's disease. There's been a huge expansion of the numbers of patients with neurological ailments. Neurological problems are not as common as things like heart disease, but they're chronic conditions, so that once somebody's diagnosed, they're treated for usually the rest of their life. And as the baby boomer generation is maturing, we're seeing more and more patients with neuroscience illnesses. Well, I think OhioHealth recognized very early that the treatment of neuroscience illnesses is a very high-tech, a very expensive proposition. Okay, it can't be done just everywhere willy-nilly. And so they really focused early on gathering and recruiting physicians with the expertise to treat these kinds of problems. And then had the vision really to say, let's make a dedicated center so that the patients don't have to travel around. It's more convenient for them. They have everything sort of one-stop shopping. So I think OhioHealth really appreciated the importance of neuroscience at an early stage. You know, this exceeds anything I ever dreamed about. I honestly never thought I would work in a center that was devoted to neurological illnesses. And my hope is that in addition to having all of the technology and the expertise, human expertise, that this will be a place, as that I mentioned, is tranquil and healing, and patients who are being treated during one of the most stressful periods in their life. Anyone who has ever been in the hospital for anything knows how stressful it is. But if you come in for a stroke or a brain tumor or even a bad back, it's highly stressful. And my hope is that the environment we create here will be healing and stress reducing for our patients as they get their care here.